Part A. Extract 1. Questions 1 to 12. You hear a hematologist talking to a patient called Mihira. You now have 30 seconds to look at the notes.
Good morning, Mihira. Please, have a seat. How are you feeling today?
Hi, Dr. Mendes. Honestly, I'm a little nervous. Ever since I felt that lump in my neck, I can't help but worry.
It's completely understandable to feel anxious, Mihira. Can you tell me a little more about it?
It all started about 2 weeks ago. I was going through my usual bedtime routine, nothing out of the ordinary. As I reached up to rub the back of my neck, on the right side where it meets my shoulder, I felt that bulging. It surprised me because it's new, and I haven't had any recent illnesses. It's gotten me worried. I hadn't noticed before. It doesn't cause any pain, but it's definitely there, a firm and round shape noticeable enough to concern me. I've tried feeling it gently to see if it moves or seems attached to anything, but it feels kind of fixed in place.
Okay, and have you experienced any other symptoms besides this?
Well, now that you mention it, I have been feeling more tired than usual lately. Like, even getting through a workday is a struggle. And I've lost a bit of weight without really trying.
Those are good things to mention, Mihira. While a swollen lymph node and fatigue are common symptoms, they can be caused by many things. However, it's important to investigate to be on the safe side. Did you experience any night sweats or chills?
Now that you say it, I do wake up sometimes feeling really sweaty, even when the room isn't hot. But I just thought I was sleeping too warmly.
I see. Can you tell me a bit about your family history? Has anyone in your close family had any form of cancer?
Actually, yes. My grandfather on my mother's side had leukemia a few years ago, but he's doing well now.
Noted. Now, let's talk about your own medical history. Have you ever had any major illnesses or surgeries?
No major illnesses, but I did have surgery to remove my appendix a few years back. Other than that, I've generally been healthy.
Okay, do you smoke or drink alcohol?
No, I only drink on social occasions and I don't smoke. It's very reasonable, 1.5 ounces occasionally.
I see. Let's do a quick examination. Based on the examination and your symptoms, it's possible you could have lymphoma. But there are other possibilities as well. To get a clearer picture, I'd recommend some tests.
Oh, that sounds serious. What kind of tests are we talking about?
We'll likely start with a blood test to get a general sense of your health. A lymph node biopsy might also be necessary.
Is that all that is needed to rule out the condition?
Absolutely. But Mihira, depending on the results of the initial tests, we might also look at PET scan to see if it has spread to other parts of your body.
It all sounds a bit overwhelming, Dr. Mendes. What happens if they do find it positive?
Let's not get ahead of ourselves, Mihira. But yes, this is treatable, especially when caught early. There are different treatment options available depending on the type and stage if that's what you have. We'll cross that bridge when we get to it. For now, the most important thing is to get a diagnosis. We'll schedule those tests as soon as possible, and I'll walk you through each step of the way.
Extract 2. Questions 13 to 24. You hear a gastroenterologist talking to a patient called Mihira. You now have 30 seconds to look at the notes.
Good morning, Mihira.
Good morning, Dr. Tori. Well, for the past few days, I've noticed a strange yellowing in my skin and the whites of my eyes. It's mostly noticeable around my palms and forehead. Have you any idea what it could be?
Yes, Mihira. Mostly this happens when a substance called bilirubin builds up in your bloodstream. Normally, your liver filters it out of your blood and excretes it in your stool. But if it is too much or your liver isn't working properly, it can cause this effect.
Oh, that sounds concerning.
Absolutely. We can do a simple blood test to measure its levels. But before we jump to conclusions, let's get some more information. Can you tell me if you've recently had any travel, changes in your appetite or bowel habits, or any unusual fatigue?
Actually, now that you mention it, I did travel to Southeast Asia a few weeks ago. And come to think of it, I have been feeling a bit more tired lately.
Interesting. Are you currently taking any medications, over-the-counter supplements, or any herbal remedies?
No, not really. I take an occasional aspirin for headaches, but that's about it.
Great. Do you drink any alcohol regularly, or use any recreational drugs?
No, I don't drink much alcohol at all, and definitely no drugs.
Okay. And how would you describe your typical diet?
Well, I wouldn't say I'm a health nut, but I try to cook most meals at home. I do enjoy a burger or fries occasionally, but not all the time.
All right, that's helpful. The blood test will be a good first step. In the meantime, staying hydrated is important. You can also try over-the-counter medication ursodeoxycholic acid to help with the itching that occurs sometimes.
That's a mouthful. But if it helps with the itching, I'm willing to try it. Itching sounds awful. Is there a test to confirm the condition?
Absolutely. We can do a simple blood test to measure your bilirubin levels. Once we have the results, we can discuss the next steps in treatment. Treatment will depend on what's causing the condition.
Okay, that makes sense. What are some possible treatment options?
Well, that depends. If the condition is caused by a viral infection like hepatitis, medication might not be necessary. Your body will usually fight off the virus on its own, and the condition will clear up along with it. However, if the cause is a blocked bile duct due to gallstones, we might need to remove the gallstones. This can be done with medication, laparoscopic surgery, or even a traditional open surgery, depending on the severity.
Surgery? That sounds serious. Is there anything I can do to prevent that from happening again?
Absolutely, Mihira. Making some lifestyle changes can help reduce your risk of gallstones. Maintaining a healthy weight, eating a balanced diet low in processed foods and saturated fats, and increasing your fiber intake can all be beneficial.
A balanced diet and more fiber sounds manageable. How long does recovery from this typically take?
As I said earlier, the recuperation period depends on the underlying cause. The blood test will give us a clearer picture of the timeline.
All right. That gives me a better idea. Thank you for explaining everything so thoroughly, Dr. Tori.
You're welcome, Mihira. Let's get you scheduled for that blood test today. We can discuss specific dietary recommendations after we get the test results.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. You'll have time to read each question before you listen. Now look at question 25. You hear a dentist called Mihira talking to a patient. Now read the question.
Good morning, Mr. David. Welcome back. How have your teeth been feeling since your last checkup? Any sensitivity or discomfort? Sometimes patients mention a twinge when having cold drinks, or perhaps a slight ache after eating something particularly chewy. We also need to make sure the gums are healthy. Have you noticed any bleeding when you brush, especially around the back molars or the lower front teeth?
Well, good morning, Mihira. Actually, yes, I have noticed a bit of sensitivity on my upper right side when I have my morning coffee. And occasionally, when I'm brushing quite vigorously, I see a tiny bit of pink on my toothbrush. It's not consistent, though. Mostly, my teeth feel fine. I've been trying to be more diligent with flossing, especially between those crowded premolars at the back.
That's good to hear you're being more careful with flossing. Now, let's talk about your brushing technique. Many people focus on the front surfaces, but it's crucial to clean all surfaces effectively, including the chewing surfaces and the areas where the teeth meet the gums. Are you using short, gentle strokes, almost like you're tickling your teeth, rather than long, scrubbing motions? And are you angling the brush slightly towards the gum line to ensure you're removing plaque from that critical area?
I think I mostly do long strokes, to be honest. It feels like I'm getting everything cleaner that way. And I tend to brush straight on, rather than at an angle. It's a habit I've had for years.
I understand. However, that technique can sometimes miss the plaque accumulating along the gum line, which can lead to gingivitis and eventually contribute to sensitivity and bleeding. The short, angled strokes are more effective at disrupting that biofilm without being too abrasive on your gums. We can go over this again after the cleaning today.
Now look at question 26. You hear a physiotherapist called Mihira talking to a junior. Now read the question.
Good afternoon, Ben. I wanted to discuss the application of the Mulligan concept, specifically the NGs, the natural apophyseal glides, for cervical spine stiffness. We sometimes see patients presenting with a restricted range of motion, often accompanied by cervicogenic headaches or referred pain into the upper trapezius. It's important to differentiate this from instability, where any passive movement elicits apprehension or a feeling of giving way. Have you encountered patients where you've considered this technique?
Yes, Mihira, I recall a few with limited neck rotation and those nagging headaches that seem to originate from the neck. I've been hesitant to apply NAGs though, as some of their reports mention the importance of maintaining a specific oscillatory pressure and ensuring the patient feels no pain during the glide. It seems quite nuanced compared to simple mobilizations.
You're right. Precision is key. The sustained accessory glide, combined with the patient's active movement into the restricted range, aims to address the positional faults often implicated in this type of stiffness. The oscillatory component isn't about brute force. It's about providing a gentle, rhythmic input that can influence proprioception and reduce nociceptive drive. If performed correctly, the patient should experience an immediate improvement in their active range of motion and a reduction in their reported symptoms during the movement. This immediate change is a good indicator that you're targeting the correct level and direction.
So Mihira, the immediate ease of movement is the primary feedback to look for, indicating we're on the right track with the glide and pressure?
Precisely. If the stiffness persists or the pain increases during the technique, it suggests either that the diagnosis is incorrect, the glide is inappropriate, or the parameters need adjusting. It's not about forcing movement. It's about facilitating it by addressing the underlying mechanical dysfunction.
Now look at question 27. You hear a pharmacist called Mihira talking to a patient. Now read the question.
Good afternoon, Emily. You mentioned you were looking for something for motion sickness? Are you experiencing nausea, perhaps with a sensation of dizziness or even cold sweats? Sometimes people also describe a general feeling of unease or even increased salivation before it really hits. It can be quite debilitating, especially on long journeys. Have you noticed if certain types of travel, like car versus boat, affect you differently?
Yes, Mihira, it's mostly car journeys, especially on winding roads. I get that queasy feeling in my stomach, and then the dizziness starts. It's awful. I've tried ginger biscuits before, which helped a little with the initial nausea, but not so much with the spinning sensation. My mother swears by those wristbands, but I haven't found them particularly effective.
Right. So, for car travel specifically, especially on those winding routes, an antihistamine-based medication, like cinnarizine, can often be beneficial. It works by interfering with the signals in the brain that contribute to that feeling of disorientation and sickness. However, it can cause drowsiness, so it's best taken when you're not the one driving. Another option, hyoscine hydrobromide, is also effective, but can have more pronounced anticholinergic side effects like dry mouth and blurred vision, so it's usually reserved for more severe cases and short journeys.
Drowsiness might be manageable if I take it before a long journey where I'm just a passenger. So Mihira, you think something that acts on those brain signals would be more effective for the dizziness than the ginger or the wristbands?
Based on your description, particularly the dizziness associated with car travel, yes. While ginger can soothe the stomach and acupressure might work for some, an antihistamine targets the underlying mechanism causing that specific type of motion-induced vertigo more directly.
Now look at question 28. You hear an eye specialist called Mihira talking to a patient. Now read the question.
Hello, Mr. Alistair. So, we've finalized your new spectacle prescription. You mentioned experiencing some blurriness at both near and far distances, particularly when transitioning between tasks like reading and looking at the television. The new lenses are progressive, which means they have a gradient of power, allowing for clear vision at all distances without a visible line. We've also incorporated an anti-reflective coating to reduce glare from headlights and computer screens, which many people find helps with eye strain.
That sounds good, Mihira. The glare has been a bit bothersome, especially when driving at night. Will these new lenses feel very different from my old single vision ones? I'm a bit worried about that initial adjustment period I've heard about, where things might feel a bit distorted, especially when looking down.
There can be a short adaptation phase, yes. Because of the varying power zones in progressive lenses, your peripheral vision might feel slightly unusual initially. Some people describe a swim sensation, particularly when moving their head quickly or looking to the sides. However, this usually subsides within a week or two as your brain adjusts to the new way of seeing. The key is to move your head to look directly at what you want to see, rather than just moving your eyes.
So, it's more about learning to use my head differently rather than my eyes? And Mihira, this adjustment period is expected for most people switching to these types of lenses?
Precisely. The lenses are designed to provide clear vision at all focal points, but your visual system needs a little time to learn how to best utilize those different zones. Most people find that the benefits of clear vision at all distances outweigh this initial period of adaptation.
Now look at question 29. You hear an occupational therapist called Mihira talking to a carer. Now read the question.
Good morning, Mr. Thomas. We've been assessing your mother, Mrs. Eleanor, and considering strategies to help her maintain independence at home. She's expressed some difficulty with tasks like preparing meals and dressing, particularly since her recent fall. We're looking at a few options, including adaptive equipment for the kitchen, perhaps a perching stool, and some long-handled utensils. For dressing, we might suggest button hooks and sock aids.
That all sounds helpful. She has mentioned struggling a bit more in the kitchen lately, and getting dressed seems to take her a long time. She's always been very self-sufficient, so Mihira, this is quite frustrating for her. She's also become a little unsteady on her feet, even indoors, which is why the fall was so concerning.
Yes, the reduced balance can certainly impact confidence with everyday activities. While the adaptive equipment aims to make specific tasks easier, we also need to address the underlying issue contributing to her difficulties. The reduced range of movement in her shoulders and hips, likely a consequence of some mild arthritis and deconditioning following a period of reduced activity after the fall, makes reaching for items in the kitchen and maneuvering during dressing quite challenging. The equipment will compensate for some of this, but improving her physical capacity is also key for long-term independence.
So, the equipment is more of a short-term aid while we work on improving her strength and movement?
Precisely. The adaptive aids provide immediate support, allowing her to participate more safely and independently now, while a tailored exercise program focusing on strengthening key muscle groups and improving her range of motion will address the root causes, making these tasks difficult.
Now look at question 30. You hear a GP called Mihira talking to a community nurse. Now read the question.
Good afternoon, Nurse Davies. We're planning the upcoming medical camp in the Aluva region, and I wanted to clarify a few logistical aspects with you. We'll be offering general health checkups, including blood pressure and blood sugar screenings, and also have a focus on maternal and child health this time, given the recent increase in reported anemia among pregnant women in that area and the ongoing efforts to improve vaccination rates. We also need to ensure we have adequate supplies for basic wound care and management of common infections.
Good afternoon, Dr. Mihira. That sounds comprehensive. Regarding the location, the community hall has been booked, and we have enough volunteers registered. My main concern is ensuring we have the right mix of personnel. We'll need staff experienced in antenatal care and pediatric immunizations, alongside those comfortable with general health assessments and basic treatment protocols. The last camp saw a significant number of elderly individuals presenting with musculoskeletal complaints, so having someone familiar with those issues would also be beneficial.
Absolutely. The focus on maternal and child health is paramount this time due to the concerning anemia figures and the push for higher vaccination coverage. While addressing general health concerns and minor ailments is always important in these camps, the specific demographic data from Aluva indicates a more pressing need in these two areas. Therefore, prioritizing staff with expertise in those fields is crucial for this particular camp's success and impact. We can certainly ensure we have some general practitioners and nurses who can handle the broader range of issues as well.
That makes sense, Dr. Mihira. So, the staffing should really lean towards those with maternal and child health experience for this one.
Precisely. Their expertise will allow us to address the most critical health needs identified in that community at present.
That is the end of Part B. Now look at Part C. Part C. Extract 1. Questions 31 to 36. You hear the conversation between a GP, Mihira, and an interviewer. You now have 90 seconds to read questions 31 to 36.
Dr. Mihira, you mentioned the sheer breadth of conditions you encounter. Does this require a different approach to continuous learning compared to a specialist who might focus on a narrower field? How do you prioritize what to learn and stay updated across such a vast landscape?
That's a very insightful question, James. Our approach to continuous learning is indeed different. While a cardiologist might delve into the latest nuances of heart failure management, a GP needs a broader understanding of everything from dermatology to geriatrics to mental health. We prioritize learning based on the prevalence of conditions in our community, emerging public health concerns, and areas where we feel less confident. We rely on a mix of resources: peer-reviewed journals that offer concise updates across specialties, online learning modules tailored for primary care, and, importantly, learning from our own patient experiences. Each unusual presentation or diagnostic challenge becomes a learning opportunity. We also benefit immensely from local and national guidelines that synthesize the latest evidence for common conditions. It's about being a skilled generalist, knowing when to delve deeper and, crucially, when to refer to a specialist who possesses more focused expertise.
The example you shared about the subtle signs of pancreatic cancer is truly impactful. It highlights the detective work involved in general practice. Dr. Mihira, are there specific communication techniques you employ to encourage patients to share those seemingly insignificant details that might hold crucial clues?
Building trust and rapport is paramount. Creating a safe and non-judgmental space where patients feel comfortable sharing even vague or seemingly unrelated concerns is key. I often start with open-ended questions like, "Tell me what's been going on," rather than leading with specific symptoms. Active listening, paying attention to nonverbal cues, and validating their feelings are crucial. Sometimes, it's about reading between the lines. A patient might present with insomnia, but through gentle questioning, you might uncover underlying anxiety related to work or family issues. It's about being curious, empathetic, and persistent in exploring the full picture, even when time is limited. We also learn to recognize red flags, certain combinations of seemingly minor symptoms that should trigger further investigation.
You mentioned the importance of meta-awareness, being mindful of your own biases and fatigue. In the demanding environment of a busy clinic, Dr. Mihira, how do you actively cultivate this self-awareness to ensure consistent, unbiased care?
It's an ongoing process, and it's not always easy. Regular reflection is important. After a particularly challenging day, I might take a few moments to review cases and consider if any personal biases might have influenced my assessment. Peer supervision and case discussions with colleagues are also invaluable for gaining different perspectives and identifying blind spots. Recognizing the signs of burnout, increased irritability, cynicism, or decreased empathy is crucial for self-preservation and maintaining quality of care. We also need to be proactive about our own well-being, ensuring we have adequate rest, support systems, and healthy coping mechanisms. A tired or emotionally drained GP is more prone to errors in judgment.
The longitudinal relationships you build with patients must offer a unique perspective on the progression of illnesses and the impact of interventions over time. Could you elaborate on how this long-term view shapes your approach to patient care compared to the often more acute focus in hospital settings, Dr. Mihira?
The continuity of care is one of the most rewarding aspects of general practice and fundamentally shapes our approach. We see the trajectory of illnesses unfold over years, sometimes even generations, within a family. This allows us to understand the social and environmental determinants of health in a deeper way. We can track the effectiveness of lifestyle changes, the impact of chronic disease management strategies, and the psychosocial factors that influence health outcomes. This long-term perspective fosters a more proactive and preventative approach. We're not just treating the immediate ailment, we're working to prevent future complications and promote overall well-being within the context of the patient's life story. It's a different kind of satisfaction, seeing someone manage a chronic condition effectively over many years because of consistent support and guidance.
The concept of social prescribing is gaining traction. Dr. Mihira, what are some of the key factors that make these non-medical interventions effective in improving patient health and reducing the burden on the healthcare system?
Social prescribing addresses the root causes of many health issues that are not purely medical. Loneliness, social isolation, financial insecurity, and lack of access to resources can have a profound impact on both physical and mental health. By connecting patients with community-based activities and support networks, we can improve their social connectedness, reduce stress, and empower them to take control of their well-being. This can lead to improved mental health, better management of chronic conditions, and reduced reliance on medical interventions for issues that are fundamentally social. For example, a patient struggling with anxiety might benefit more from joining a gardening club and building social connections than solely relying on medication. It's about recognizing the interconnectedness of health and addressing the broader determinants of well-being.
Dr. Mihira, you touched upon ethical accountability in the context of digital health records. What are some of the key ethical considerations that GPs must be mindful of when using these systems, particularly regarding patient privacy and data security?
Ethical considerations are paramount when dealing with sensitive patient data. We have a responsibility to ensure the confidentiality and security of electronic health records. This involves adhering to strict data protection regulations, implementing robust security measures to prevent unauthorized access, and being transparent with patients about how their data is being used. It's also crucial to be mindful of potential biases that might be embedded in algorithms or decision support tools within these systems. We need to ensure that technology enhances equity in healthcare delivery and doesn't inadvertently perpetuate existing disparities. Furthermore, while these systems offer efficiency, we must not let them depersonalize the patient-doctor interaction. Maintaining that human connection and empathy remains at the heart of good medical practice, regardless of the technology we use. By continuing to explore these themes with more detailed questions and thoughtful responses, the conversation becomes even richer, providing a deeper understanding of the multifaceted role of a general practitioner.
Now look at Extract 2. Questions 37 to 42. You hear a presentation by physiotherapist Justin Hayfield about the modernization of rehabilitation at Mihira Care. You now have 90 seconds to read questions 37 to 42.
Good afternoon, everyone. It's a privilege to welcome you all to Mihira Healthcare Institute, and today, I'm honored to present the strategic advancements we've made in our physiotherapy department under the broader initiative known as Mihira Care. As we move deeper into patient-centered, data-informed practice, Mihira Care has embraced a suite of cutting-edge technologies designed to optimize recovery, improve patient engagement, and refine clinical decision-making. These advancements are more than just tools, they are a shift in how we approach healing. Let me begin by addressing the fundamental question: why was there a need to invest in this new wave of equipment at all? Over the past 5 years, Mihira Care has documented a noticeable change in patient demographics. We're seeing more complex post-operative recoveries, neurodegenerative conditions presenting earlier, and an uptick in sports-related injuries among middle-aged adults, many of whom return to high-performance expectations post-recovery. Traditional modalities have served us well, but increasingly, they fell short in terms of real-time adaptability, precise neuromuscular feedback, and patient-driven data visualization. The goal was never to replace clinical expertise, but to extend it, augment it. Our rehabilitation plans needed tools that didn't just replicate function, but could map, measure, and modulate it. This brings me to the equipment itself. What exactly have we introduced? At the heart of this transformation is the Bertec sensor system, a state-of-the-art pressure mapping and gait analysis platform that offers dynamic weight distribution tracking. In conjunction with this, we've integrated the AlterG anti-gravity treadmill, which has revolutionized lower limb rehabilitation by enabling partial body weight support during ambulation. For neuromuscular re-education, we now have the NeuroCalm Balance Manager, which provides immersive postural feedback and cognitive dual task assessment. We also introduced a range of isokinetic dynamometers, allowing us to generate precision torque and fatigue profiles for patients recovering from ACL reconstructions, rotator cuff surgeries, and more. Every piece of equipment installed at Mihira Care reflects a specific functional gap previously observed in patient outcomes. So why are these systems important beyond their technical prowess? The advantages are both clinical and psychological. Firstly, the quantifiability these tools offer helps us refine progress markers, not just feels better or moves easier, but precise degrees of range gained, real-time balance recalibration, and strength-to-weight ratios. Secondly, the patient becomes more actively involved in their own recovery. Seeing visual biofeedback, especially in the early, frustrating phases of rehabilitation, increases compliance and motivation. Thirdly, it allows interdisciplinary teams at Mihira Care to communicate using shared metrics. An orthopedic surgeon, a physiotherapist, and a case manager can look at the same set of kinetic data and plan more cohesively. Lastly, and crucially, these devices assist us in identifying compensatory movement patterns before they evolve into long-term biomechanical dysfunctions. Now, the question arises, what exactly is the overarching aim of this implementation? It isn't to flash shiny equipment or to merely digitize old routines. At Mihira Care, our mission has always been function-led care. The integration of advanced equipment is part of a broader goal to make rehabilitation predictive rather than reactive. We want to detect potential risks before they translate into setbacks. We also want to reduce the average duration of therapy without compromising on outcome robustness. The aim is high-precision recovery with minimum friction, especially in patients with comorbidities or high-demand recovery goals. Of course, none of these tools were selected arbitrarily. The selection process at Mihira Care followed a deeply analytical path. We conducted a year-long audit involving 387 patient recovery cycles and 18 practitioners, documenting where traditional methods fell short. Following this, a collaborative assessment committee consisting of physiotherapists, biomechanical engineers, orthopedic consultants, and digital health specialists shortlisted 11 systems from a global pool of 47 vendors. Usability, training adaptability, post-market surveillance data, and compatibility with our existing electronic patient records were key metrics. Vendor demonstrations were followed by pilot testing, and only those with a tangible delta in patient trajectory were selected. Finally, how do we measure the success or impact of these tools? Implementation alone doesn't equal improvement. That's why Mihira Care has embedded a longitudinal outcomes framework. We're currently collecting baseline-to-discharge data across 12 functional domains, from gait symmetry to proprioceptive recalibration. Beyond numbers, we are also capturing subjective improvement through the PROMIS, Patient-Reported Outcomes Measurement Information System, modules. This two-pronged evaluation, objective data and patient experience, allows us to refine protocols continuously. In fact, early indicators suggest a 17% reduction in recovery time among patients using the anti-gravity treadmill compared to standard treadmill reconditioning. That's not anecdotal, that's actionable. To conclude, what you see at Mihira Care today isn't just a technological upgrade. It's a philosophical shift. We're turning recovery from an act of repetition into an act of informed precision. And in doing so, we honor the one thing that matters most in healthcare: progress that lasts. Thank you.
That is the end of Part C. Now check answers.